Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from North Shore University Hospital to help you sort through what's going on with COVID-19 in our communities and across the region. Of course, we always want to hear from you. Call us at the number right there at the bottom of your screen, 516-393-1800. Well, let's get right to it. Every number is a face and every number is a family. Governor Cuomo referring to the victims lost in what he calls a vicious virus. Today he announced the highest single-day death toll yet. That's 779 deceased. He did add, though, the curve is flattening because of our actions right now. And that brings the state's death toll to more than 6,200. To put that number in perspective, we lost a little more than 2,700 New Yorkers on 9/11. Nassau County has lost 566 to COVID-19. Today, Suffolk Executive Blown said the virus has claimed more than 300 lives. Nassau Executive Laura Curran says for the third day in a row, the number discharged from hospitals is larger than patients coming in. Now, she said we could be approaching a plateau. Now, the total number of confirmed cases there exceeds 18,000. Suffolk Executive Blown called Suffolk's more than 17,000 cases staggering. See the numbers right there on your screen. Now, on a hopeful note, he says in the last 24 hours, 130 COVID-19 patients have been discharged from the hospital. And across the state, from day one to now, there are almost 150,000 who have tested positive. The governor today ordered all flags to be lowered to half staff in honor of those we have lost to COVID-19. And minority communities here in the island and really across the nation are being hit especially hard by the virus. A new testing program in Suffolk County that's targeting the minority communities that are seeing a spike in the number of COVID-19 cases. The county executive says the goal, directly connect the affected families with resources that can actually provide help. Now, a bit of good news for those out of work. The governor did announce today the state's going to make an additional $600 payment to all those who filed for unemployment. And the state is also extending the period covered by unemployment benefits for another 13 weeks. That brings the total to 39 weeks. And tonight, Passover begins. Jews here on the island and around the globe, they're celebrating the holiday very differently this year. Many will be hosting their virtual Seder dinners. That's via Zoom. And families of the Jewish faith we spoke with say it's not the ideal way to celebrate. Of course, it's not the Festival of Freedom, but they will honor the true spirit of the holiday any way they can. All right, let's get to our discussion right now. Joining us tonight, Dr. Evelina Grayver. She is a cardiologist and head of cardiac critical care at North Shore University Hospital. You are also the lead physician for the COVID-19 unit there at North Shore. Appreciate your time doing all this. It's really phenomenal what people in your profession right now are doing on the front lines, and we do appreciate that. Let me first ask you. I know that tonight you're going to be beginning to celebrate Passover as well. How are you doing?
Well, considering the fact that I just got home, where the meal will just be started, but we're also going to be doing everything virtually via Zoom. So it's going to be Zoom Seder for my entire family.
Okay, well, happy Passover, and I hope you enjoyed that holiday.
Thank you. Happy Passover to everybody as well.
Let me ask you this: how's the hospital? How are your resources holding up right now?
We're actually okay regarding resources. I think that we are definitely limited regarding potentially making sure the fact that we're not using it sparingly, but I have yet to feel at this point as to whether or not I am missing any essential part of my equipment at this point.
Okay, and the governor is saying, the county executives are all saying that we may be hitting that plateau. Are you seeing that with the number of cases being discharged outnumbering the number of cases coming in?
So I'll tell you, North Shore, Northwell as a system has a new thing where we hear chimes every single time that a person is getting discharged. And there were a lot of chimes today. So we are seeing a lot of discharges. However, it's not even the discharges that we're seeing. We're seeing sort of a equilibration regarding potentially those people that are also coming in as well.
Okay, well, that's some glimmer of hope right there. Let's get to the phone lines right now. Marcus from Sayville. Marcus, you there?
Yes, hello.
Thanks for calling. What's your question?
Well, what I'm concerned about as a single dad, and, I split my time with my child's mother. What's the danger in, my kids splitting their time between two households.
Doctor, what advice would you give?
So I can actually clearly relate. I am a single parent myself. And obviously, because of my profession, I actually come home and I run the risk of exposing my child. I think that potentially knowing the fact that children could potentially be asymptomatic carriers, I would avoid having the child go from one home to another, just because of the fact that you never know. And again, I don't know what you do for a living, Mark, nor what your wife does, and whether or not you guys are able to stay home. But I would potentially try to avoid that child going from one home to another. And I know that it's heart-wrenching for a single parent and for a child as well, not to be able to see the other parent. But I think that children are beginning to understand a different normalcy and a different routine, and understand that hopefully this is nothing but a temporary measure where they have to potentially FaceTime with the other parent, have Zoom conversations with them, and just giving them hope, the fact that this is all just temporary.
Okay. Gary, I hope that that's some good advice for you, Marcus, and good luck to you. Gary from Hicksville. Gary, you there?
Yeah, I'm here. How are you guys?
We're doing great.
Hi.
What's your question?
With Americans being, with summer being right around the block, should Americans be scared of the virus being transferred with mosquitoes now?
Oh, great question. That's a really great question. We know the fact that, and especially recently, I believe the fact that there was some news, the fact that there was I believe a lion that was infected in the Bronx Zoo. I think that there's a potential for a different type of strains and for potentially from mosquitoes to be carrying it. We don't know. So we know the fact that the transmission of it kind of changes, right? Initially, we thought that it was nothing but just based upon droplet. Now we're thinking there's a component to aerosolized component. We don't know as of yet, and nothing has been reported yet regarding potentially actual bite from mosquitoes. But that is a potential risk, especially if there's going to be any type of mutation of the virus, which is one of our biggest concerns in the medical field, because that's what viruses do. They're quite smart, and they do mutate.
All right. And the scary thing is this is also new, so there's so much we don't know yet. That's a very scary thing. All right,
Yeah.
Rosemary from Mastic Beach. Rosemary?
Hi.
What's your question tonight?
My question is, on 12/22/2019, I was hospitalized in Suffolk County Hospital, and I had, in Stony Brook Hospital, and I had Corona 9. And my question is, what's the difference between the Corona 9 and the COVID-19? I was very sick, and I had high fever, and I also had a pneumonia. So I wanted to know what's the difference between that and what we have now.
Great. That's an amazing question. So the difference is what I mentioned, is the different strains. Coronavirus in itself is something that's been around for a very long period of time. But this strain specifically, coronavirus 19 or COVID-19, is something very different because it's associated with a different type of inflammatory cascade that it triggers in the body that has not been seen in the past. So yes, people have come in for centuries with coronavirus illnesses, but they have not been associated with this degree of illness. Now, if you were sick in December, and some of the first cases did come out in December as well, it would be interesting eventually when we have the availability to test for antibodies to see whether or not you actually have developed antibodies for COVID-19 as well.
Wow, okay. Philip from Shirley. Philip, you there?
Yes.
What's your question tonight?
Okay. Doctor, I have 3 masks. I have an N95 and 2 paper masks. Can I disinfect them by spraying like 80% alcohol on them?
No, unfortunately you cannot, because the minute that they get moist, they lose their ability to be protective. So one of the ways that we actually in the hospital protect our N95 masks is we actually specifically put a surgical mask on top of it to avoid any type of moisture. So you do not want to actually get those masks wet, and you do not want to put any type of disinfectant on them. If you do want to have just a kind of a regular mask that you can come out with and everything else, there is some component of availability of protection with the cotton masks that you can subsequently disinfect and wash afterwards.
And doctor, just to follow up on that, would you recommend if someone had a scarf and they wanted to wear a scarf, or is that sufficient to do that out in public?
It's better than nothing. It's not sufficient, but it's definitely better than nothing. The surgical masks literally block out no more than approximately 5 to 10% of oxygen, and the cotton, I think the last quote was about anywhere from 3 to 5%.
Okay, let's try to squeeze in one more question here. Annalisa from Farmingdale, are you there?
Hi.
Hi, what's your question?
My husband's a first responder, and once he recovers and goes back to work and gets re-exposed to this virus, can he be a carrier of it and then bring it home to me and my kids? And he's just not going to get sick, but we are?
Right. So yes, he potentially can be an asymptomatic carrier. We do know the fact that 20 to 25% of people that are affected by the disease can be asymptomatic carriers. So you have to be always quite cautious with anybody that works in the front line to make sure the fact that they use every and all possible precautions, and especially when they come home, to make sure the fact that they take a hot shower to wash everything off, including off of their hair as well, before they come in contact with you or your kids.
Should he consider social distancing himself even once he recovers?
How long has he been sick for?
I think 11 days. I think 11 days.
11 days. So usually it's 14 days. Afterwards, he does not need to maintaining social distancing like all of us do, with 6 feet apart and wearing a surgical mask. But he doesn't particularly have to do anything more than that.
Okay, we're going to take a real quick break, and we're going to have much more expert advice on how to keep you and your family safe from the coronavirus. Remember, we want to hear from you. Call us with your questions. The number right there on the bottom of your screen, 393-1800. That's 516 area code. If it's busy, just keep calling. We'll answer. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in the doctor, Dr. Evelina Grayver. She's a cardiologist and head of cardiac critical care at North Shore University Hospital. You're also the lead physician for the COVID-19 unit in the hospital right now. Again, thank you so much for all you're doing. Let me ask you this. I know we got about 15 minutes before Passover begins, and we're heading into Easter as well. These are tough conversations to have, but are you seeing patients that are prepared with those decisions that they've made with their family members as they come in?
Having the conversation about advance directives is never something that any family would choose to do over a dinner table, especially during the holidays. But I think that given the chance to do it, this is the perfect opportunity for it. Perfect opportunity to understand what your loved ones' wishes would be, that if they're ever getting to the hospital, how aggressive would they want as their therapy? Do they want to be put on the ventilator? Do they want to be resuscitated? Do they want their chest to be compressed? Those are incredibly difficult decisions to make. As a physician, when you don't have sort of that guidance from the patient and from the family. And at times it's very difficult for somebody like me who's in a critical care unit and who receives a patient who's already on the ventilator, and at that period of time, I cannot discuss their care with them. So appointing actually a healthcare proxy would be incredibly important as well.
Yeah, very tough conversations, but incredibly important. Thank you for that. Back to the phone lines, Rosemarie from Westbury.
Yes, hi. Good evening. I do have a quick question. I enjoy walking, and I wanted to know if when you're out walking, is there a need to wear a mask? And when you come home, should you shower and immediately, have your clothes up, take and shower?
Yeah, Rosemary, so similar to what I kind of mentioned before, the transmission of the virus, because we still don't know a lot and we're learning pretty much every single day about it, I would definitely maintain social distancing when you're walking. Definitely put on a mask when you are walking, because there is a component of aerosolization to the actual virus. I'm sure that as you're walking, you're actually also seeing that a lot of people are unfortunately dumping a lot of their own protective equipment on the ground, their gloves, their masks. And because of the fact that we don't know who that came from and whether or not any of that virus could be on any of that protective wear, I would definitely be quite cautious. So yes, definitely put on a mask when you're walking. Definitely come home and take a shower. Definitely wash off your cell phone. That's the one thing that people always forget to do. Also, disinfect your cell phone. Leave your shoes outside and spray them down with a disinfectant as well.
Okay. Tony from Oceanside. Tony, there?
Yes. Hi. How are you, doctor?
Hi.
My question is, if a person is positive with coronavirus and smokes a cigarette, can that exhaled cigarette smoke carry the virus?
It's an interesting question. I don't particularly, honestly, I don't know whether or not you can potentially exhale with the smoke, with the actual virus. However, when they did studies a long time ago regarding whether or not there's any saliva that comes out with the time that you actually exhale, and they did find that there is definitely a component of saliva. And we know the fact that we can trace the virus in the saliva. So I want to say yes, just from that kind of a background information and background knowledge.
Yeah. Good time to quit.
Yes, absolutely good time to quit.
Yeah. Caitlin from Holbrook. Caitlin? Caitlin, you there?
Hi, yes. Can you hear me?
Yes, I can. What's your question?
So first off, doctor, thank you for all the work you're doing right now.
Thank you, guys. Thank you for the support, and thank you for the 7 p.m. claps. Those are very helpful, by the way.
I was calling, so I was wondering, while patients with pulmonary issues are the ones being affected with COVID right now, how is COVID affecting other organs, like such as your heart? Is it causing heart failure or damaging tissue?
An amazing question, and the answer is yes. COVID itself causes a significant inflammatory response, meaning the fact that all of these inflammatory markers are genuinely flying all over your bloodstream and affecting everything from your heart to your stomach to your kidneys to your brain. At a certain point, COVID actually causes your blood to be actually incredibly thick, and patients are at significant risk for forming DVTs, which is clot in the leg, and subsequently pulmonary emboli, which is clots that actually travel to your lungs. A lot of patients actually also have a significant effect with a stroke, again, because of how thick the blood can get. And myocarditis is one of the biggest cardiac complications that we've seen so far. And myocarditis is sort of the inflammation of the heart wall and significant weakening in the heart muscle, causing heart failure.
Okay. Doctor, what's the biggest need that you and your colleagues need from Long Islanders right now?
Your support and your love. The amount of food that you guys send us over to the hospital is phenomenal. What we need is for you guys to stay home and to continue with the social distancing. I know the fact that there's lots of talks of potentially opening up the beaches and opening up the parks. At this period of time, I would definitely hold off. So the biggest help that I can ask for you guys is to continue with social distancing, stay home, and please stay safe.
All right, Dr. Grayver, you are one of our heroes. We appreciate everything you're doing. I appreciate you coming on after what must be incredible long hours. So thank you very much for your time. Stay safe. Anything you need, just let us know right now.
Thank you.
You're watching our coronavirus pandemic special report.